Hi guys, my name is Kelly. I'm going to perform the IV piggyback skill for you guys. So the first thing that I want to do is make sure that I verify my patient's MAR with the physician order. So I'm going to go ahead and do that. And so this is for Miss Wanda Chi, 920, 19XX, 920, 19XX. It's 8 o'clock. And I'm going to be giving 500 ml of 0.9% sodium chloride to infuse over 10 hours, drop factor micro drip tubing, 60 drops per milliliter. That matches my physician's order and my MAR. I'm gonna also give an 8 o'clock ampicillin, 500 mg IV piggyback to infuse over 30 minutes, ampicillin, 500 mg IV PB to infuse over 30 minutes. And no allergies, everything matches, everything looks good. So while I have her orders up, I'm also going to want to look at her lab results and make sure that I'm able to give this to her. Also, her vitals were done like 5 minutes ago and she's stable. So I'm ready to go into the med room to get my supplies. So I performed hand hygiene and I'm grabbing all of my supplies. Nothing is expired, everything's brand new. I grabbed my saline here, there's no holes, it's not expired. I'm doing my first drug check. So again, I wanna make sure this is for Miss Wanda Chi, 920, 19XX, 8 o'clock, 500 ml of saline that I have here to give over 10 hours. And I have my 8 o'clock ampicillin, 500 mg to infuse over 30 minutes. And it's actually in a 100 ml. So I'm gonna have to do some dosage. So I'm gonna do that just really quick. 500. I'm gonna do 500 ml over 10 hours, which is going to equal to 50 ml per hour. And then I'm gonna do a drop rate, which I will show you at the end. 500 ml over 600 minutes times 60 drops per milliliter, which is going to equal 50 drops per minute, which is then going to equal about 13 drops per 15 seconds. I'm going to do my dosage for the ampicillin, 500 mg over 30 minutes. And it's in a 100 ml bag, 30 minutes. So I'm going to times that times 2. And I'm going to program my pump to 200 ml per hour. So let me show you that just quickly. And so I've gotten my meds here and I want to make sure that they are compatible, and they are. And I've also checked drug side effects for the ampicillin, and it causes nausea, vomiting, and diarrhea. And it's within range, and I'm able to give it to my patient. So I've gathered all my supplies, like I said. Everything is great, nothing is expired, and I'm ready to go into Miss Chi's room. So knock knock, I'm coming in, I'm performing hand hygiene. Hi Miss Chi, my name is Kelly, I'm going to be your nurse today. The doctor has ordered some fluids and a med to give to you today. Is that okay? She says yes. Thank you very much, Miss Chi. Could you just verify your name and your date of birth for me? Wanda Chi, 920, 19XX. And do you have any allergies? She says no. I've pulled up my chart here just to make sure that this is for Miss Wanda Chi. And so I see that she has an IV in place already in her right forearm. So I'm going to want to assess her IV. So I'm going to come here and I'm going to clean it off. And I'm going to want to make sure that I can flush. And again, there's no redness, there's no infiltration noted. So I'm flushing, making sure it's good. And it's a good IV. So I'm gonna leave that there. And thank you very much, Miss Shi. And I've already flushed about 2 ml in there. So I'm going to go ahead and do my second drug check. So I pulled up her chart. Again, this is for Miss Wanda Chi, 1920, 19XX. I have already verified her ID band. And this is for 8 o'clock, 500 ml of sodium chloride, and I have it here. And I'm gonna infuse this over 10 hours, which is gonna be 50 ml per hour. And I have my 8 o'clock ampicillin, 500 mg, which is 100 ml that I'm gonna give within 30 minutes. So I'm going to go ahead and prime this. And again, like I said, this is all brand new tubing, has never been used. I wanna be very careful with it and keep sterility. And I lost my top to this, and so we're gonna pretend that it has a top. So I have all of this, making sure that it doesn't touch the ground. It's untangled. Again, making sure that everything is sterile. I popped off the top to this thing here, and I'm going to clamp it in there. And I'm going to go ahead and hang it to prime. And again, like I said, this is brand new, so I'm taking my top off here, and I'm going to squeeze and make sure I get all the bubbles out of there. And so that looks good. So I'm gonna clamp and make sure that everything's good. And also when I checked Miss Chi's IV, I unclamped it and then clamped it back up. So that's good. And now I'm going to prime my ampicillin. Again, making sure that everything stays sterile. And it is sterile. It is primed. So that's good. I just want to hang this one above. And I'm going to go ahead and connect it here. And make sure I grab my alcohol swab that is brand new. And I'm going to clean, hook it up, making sure everything is still clamped. Nothing is unclamped because I'm not ready to give it. And then I'm gonna come here and everything is primed. So I'm going to go ahead and actually connect this to Miss Chi. I've already flushed it, so it's okay for me to put it on. So everything is clean with that brand new alcohol. And I'm also gonna wanna go ahead and label my tubings. So I've already done a name, initial, and time. Initial, date, and time. And I'm gonna just put this on my tubings, on both of them, for to be changed for 96 hours. And if it had any sugar or any additives in the saline or the med, I would change it every 24 hours. So that's good. Everything is still clamped. I have not started my med. So this is going to be my third check. So I'm going to want to look at Miss Chi. Miss Wanda Chi, 920, 19XX, 8 o'clock. I'm giving 500 of ml, 0.9% sodium chloride to infuse over 10 hours. And I do have my 500 ml here that I'm gonna give 50 over an hour. And then I have my 8 o'clock ampicillin, 500 mg to infuse over 30 minutes. And this is in a 100 ml bag. So I'm going to program my pump here. And so I'm going to want to put my primary, which is my saline. I'm going to do 500 ml over 10 hours. So on my pump, I'm going to put 50 ml over an hour with volume of 500 ml. And so that's going to say that it's going to take the 10 hours to give. Then I'm going to program my secondary, and I'm going to put in that I have to give 100 ml over 30 minutes. I'm gonna put in that I have to give 200 ml over an hour with the volume of 100 ml. So then that's gonna go within 30 minutes. So everything is good. I've already explained to Miss Chi that she may feel some nausea or diarrhea. So I am going to go ahead and unclamp everything. And I'm going to go ahead and push start on her pump here because I've already done my third check. And so again, I'm gonna just address this to Miss Chi. Miss Chi, you may feel a little nauseous, okay? So here's your call light. I'm gonna lower your bed and put your rail up. please call me if you need to get out of bed or if you need to use the bathroom. And I'll be back within 30 minutes, okay, to see how you're feeling. She's connected to her monitor, so everything's good. And so I just want to document, and as I'm documenting, I'm assessing Miss Chi, making sure she's taking these meds in great. And I want to document that I'm giving my 500 ml of saline and my 500 mg of ampicillin, and that she is tolerating well, that the IV site flushed well, and that it's in her right AC. And that's all I'm going to document. And so that I would perform hand hygiene, say my goodbyes, be back in 30 minutes, and that's it. And so now I'm gonna show you my drop rate. And so I've already done my dosage that I did at the beginnings, but let me show you again. So I did my drop rate there in the middle. And so I know that I'm gonna be giving this 50 drops per minute. And so I wanna just go ahead and do that for you now. And I want to make sure that I'm giving about 11 to 15 drops per 15, I would be giving 13 drops per 15 seconds, and just want to make sure I stay within the 11 to 15 drop range there for 15 seconds. So I'm going to go ahead and just start it a little bit, like really slowly. And I'm gonna go ahead and count. Okay. So again, like I said, I want to give 13 per 15 seconds. And make sure that I stay within the 11 to 15 drop rate or range. And that's that. And so I labeled and did all that, okay. And again, I want to make sure that I said that I would unclamp everything once I've done my third check. And I'm ready to give this to Miss Chi. Unclamp her IV here and everything's good, and so she's receiving it well, and I think that's it. Thank you.